Sea lion bite by Marty McCafferty. The diver was a 67-year-old male with 35 years of diving experience. Early one afternoon, near La Paz, Mexico at Los Islotes, a popular dive site and sea lion rookery, a sea lion bit the diver on the stomach. At the time of the attack, he was scuba diving in less than 6 meters of seawater, with approximately 50 other divers from several dive boats that were present. After the attack, fellow divers and crew helped him back on board. They removed his 3mm wetsuit to assess the injury and control the bleeding. He was conscious and lucid the entire time. The liveaboard arrived in the harbour approximately 2 hours later, just before 3 in the afternoon, and the diver was transported ashore in a waiting panga boat. The crew had dressed and bandaged his wound, and he was in good condition overall. The patient, trip leader, and crew determined that waiting for an ambulance might delay transport, because unfortunately ambulances in that area can't always provide timely responses, and so the trip leader chose to drive the diver in his private vehicle. During the drive, the diver's vital signs were normal, and he did not show any signs of distress despite the obvious wounds. Because he appeared stable and the bleeding was controlled, they chose to go to a nearby local clinic. Area hospitals are usually quite busy with patients, which could have delayed the treatment further. They arrived at the local clinic just before 4 in the afternoon, and the attending physician assumed care of the patient. The wounds were 2 parallel lacerations about 5 centimeters long, 1.5 centimeters wide, and 3 centimeters deep, with some adjacent puncture wounds. The doctor and his staff thoroughly cleaned the wounds, injected a local anesthetic, and sutured the wounds closed. 2 internal sutures were used first in each wound as they required a multi-layer closure. Before he completed the closure, the doctor placed a sterile wick to promote drainage. One of the small puncture wounds required a single suture to close. At the doctor's direction, a nurse administered a tetanus booster, and the diver was discharged around 6 in the afternoon, his traveling companions escorting him to his hotel. This incident is an excellent reminder of why dive operators need to have pre-existing emergency action plans, and not to hesitate to implement them. It also serves to illustrate that any action plan needs to accommodate emergencies beyond those involving decompression illness. For dive crew, excellent first aid skills for physical trauma are a must. The dive operator contacted local personnel who were familiar with local resources and made a decision based on their input and knowledge. The operator decided to transport the injured patient with the assistance of an emergency medical technologist who was on the trip, as well as a local lifeguard, also an EMT. Medical evaluation and treatment are necessary with any injury in which the skin is penetrated in a marine environment. Seals and sea lion bites, in particular, have a high probability of infection. The importance of proper cleansing and disinfection cannot be overstated, even with apparently small wounds. All such wounds should be monitored for signs of infection, at least for 7 to 10 days. The signs can include increased swelling, pain, or tenderness around the wound, increased redness, a foul-smelling discharge from the wound, red streaks extending away from the wound site, fever, and nausea. Although it's not entirely clear why the sea lion bit the diver, a witness saw 2 bull sea lions fighting aggressively, and then one turned to flee from the other. The diver was approximately 15 meters away from them, but he was in the path of the fleeing animal and was bitten. Regardless how playful or docile marine animals may appear, we should not forget that we are the visitors in their environment and should remain keenly aware of their behavior. Be sure to learn how to observe and approach animals, and always follow experts' recommendations. Seal and sea lion injury management. Contact with seals or sea lions can result in severe infection as a result of bacterium leptospirosis, also known as seal finger. Avoid feeding seals, as this will significantly reduce the likelihood of seal-human contact. Prevent contact between dogs and seals. Diseases can be transmitted between them. Wash any wounds caused by seals or sea lions thoroughly with disinfectant and dry them. Seek medical care for any injuries resulting from these animals, as there is the potential for serious long-term health implications. And be sure to tell the doctor that you were bitten by a seal or sea lion. Observe for unusual signs or symptoms for 7 to 10 days, and go back to the hospital if you feel unwell at any time. Although uncommon, unprovoked sea lion bites can occur, and divers should be aware of this potential hazard.